This is a demo video on the Kerala Palliative Care Grid that will demonstrate how a patient can log into the grid to avail services, and how a nurse can log into the grid to provide services to patients. The flow begins with patients visiting the Kerala Care webpage. The page is available in both English and Malayalam for easy access. Patients can log into the webpage, go through the content such as the available services, statistics, and an FAQ about the grid and its services. Patients then navigate to the facility finder, where they can enter their district and local body, such as the Panchayat, municipality, or corporation. After selecting their local body, they can click on Continue. This takes them to the facility finder page, where all the facilities within their selected district and local body are listed. Patients can select the nearest facility and click on View Facility to see the details, including the available facilities and the list of doctors or nurses available within the facility. They can then select a nurse and click on Book Appointment. Next, they will be asked to enter their mobile number for validation. After entering their mobile number, they need to click on Send OTP and validate it with the OTP received on their mobile phones. After validation, they will see a calendar with all available dates and slots. Choose the date and slot and click Continue. If a patient profile already exists for the provided mobile number, it will auto-populate here, and patients can simply click on Confirm Patient and confirm the booking. If this is a new patient, then registration is needed. Click on Add New Patient and enter the patient's name, basic information to complete the registration. Then click on Register Patient. Now, we've created a patient profile and scheduled an appointment for the selected slot. Let's demonstrate how a nurse log into the system and record visit. The nurse will use their credentials to log in. Once logged in, they will see all the facilities assigned to within their profile. Select the facility they are working in and click on Appointments. They will be able to see all their appointments for the week, and there's a filter so they can choose to view all the appointments available today, next week, or next month. For example, if selecting today, the nurse will see all their appointments for that day. They can check details like the patient's address, the patient's mobile number, and the time slot that has been selected. The nurse will visit the patient at the designated time slot. Once they reach the patient's house, they click on Check In. This indicates that the nurse has arrived at the patient's location. They will then start the consultation with the patient by clicking on Start Consultation. A patient card is created with the patient's name and date of birth. The next step is to create an encounter for the visit. Once they click on Create Encounter, multiple options will be available. Our tool supports a hospital management system, so there are different options like ambulatory, inpatient, observation, emergency, and virtual. For palliative care, home health will be the default selection because the nurses will be visiting the patients at their homes. They can then select the status of the encounter and also the priority, whether it's an emergency or a routine checkup, and click on Create Encounter. An encounter or patient visit form is then created with basic information. The nurse will then consult with the patient, provide care, make diagnoses, and perform all required actions. They will fill out the Community Nurse Home Care form. This questionnaire facility allows us to create questionnaires in any template as per requirement. The current questionnaire, the Community Nurse Home Care form, has been built in collaboration with the National Health Mission. Kerala provides all the necessary information, including the fields required for the questionnaire, which we have developed accordingly. The questionnaire requires information on symptom diagnosis. For example, symptoms like coughing or headache could indicate a fever. Other information includes bowel movement, bladder function, nutrition, food intake, vital signs, ongoing medication, and the nursing care received. The comfort device chosen by the patient and the care plan based on the patient's condition are also needed. In the same form, the next visit can also be scheduled. We can choose the required date and time, and then click on to submit. Now, the patient's visit or encounter has been updated with all the necessary information, and a follow-up appointment has also been scheduled. If we go to the patient's profile and click on Appointments, we can see all the appointments, which includes the ongoing and also future appointments. The patient's profile contains all the information on all the encounters and the health profile. It includes ongoing medications, any recorded allergies, symptoms, and so on. If there are any requests from the nurse during the consultation, for instance, to send a request to the facility, such as a request for a wheelchair, it can be categorized under comfort devices. The nurse can fill in all the required details and then click on to submit. Now, a request has been sent to the facility regarding the patient's need for a comfort device. The facility has the ability to review the requirements and either approve or reject them. In the patient profile, there is also an option to add files, such as additional reports and lab results. Once everything is complete and the visit is done, the nurse can click on Update and mark the encounter as complete. Marking the encounter as complete before leaving the patient's house signifies that the visit has been conducted and all visit-related information has been recorded. This is the process of how a patient registers for care and how a nurse provides care for a patient. Monitoring all grid operations is possible through dashboards. For instance, the state dashboard provides an extensive overview of grid operations at a state level, including statistics like the number of patients, patient visits, and facility registrations, etc. It also offers patient-level data, such as gender and age distribution and more. Furthermore, encounter-level information, which includes patient's mobility status, nursing care, and grid activity for the day and the past 7 days, is accessible via the state dashboard. For a more detailed analysis, we have specific dashboards available at the district, local body, and ward levels. To view a specific district's data, simply needs to select the desired district and click View Dashboard. This action generates the district-level dashboards, offering a comprehensive view of grid activities within the chosen district. It's important to note that this is a pilot dashboard, and it will continue to evolve and update. Within the district dashboard, you can delve deeper to see the local or self-governing bodies within the district. For instance, if you select the Kozhikode district, the Kozhikode district dashboard will be displayed. Clicking on the Kozhikode Corporation will display the next level dashboard for the Kozhikode Corporation. You also have the option to view data at the ward level. For instance, selecting any ward from the Kozhikode district, such as Kanasuri, will display the ward level dashboard. This dashboard provides all the information regarding patient visits from the selected ward.